Good evening everybody, myself Dr. Avinandan Banerjee, consultant-nephrologist and transplant physician attached to CMRI Hospitals, Kolkata. Today I am going to speak on diabetic kidney disease, or in short term it's called DKD. As we know, diabetes is one of the most important and the most number of patients are rising day by day, not only over the world but also in Indian subcontinent. India is sitting on an epidemic of diabetes because of the increasing obesity, increasing age, increasing sedentary lifestyle and dietary habit. So as diabetes numbers increase, there is more chance of developing diabetic kidney disease. As many as 40% of diabetic patients who are suffering from type 2 diabetes have kidney disease. More than 10% of the patient doesn't know that they have diabetic kidney disease in spite of having the disease. So what happens is that basically if we detect diabetic disease early, the chance of developing ESRD can be delayed or prevented. ESRD means patient going into dialysis. So those who are having diabetes for a long time, type 2 diabetes for a long time, at least more than 5 years, who have a family history of diabetic kidney disease, who have a sedentary lifestyle or having obesity or uncontrolled hypertension, should check their albumin creatinine ratio regularly, at least 6 months in the gap, because before rise of creatinines, this albumin creatinine ratio will give you a hint that your kidneys may be in danger. So if the albumin creatinine ratio can be controlled, probably you will not go into a ESRD, and for that reason you need certain amount of drugs, certain number of drugs which are prescribed by the endocrinologist, as well as you need to change your dietary style. The protein needs to be restricted, you need to restrict the fiber intake and the potassium intake and other things that should be counseled by a dietitian. Other than that, diabetes also give rise to other diseases as well, including the cardiac disease, which can compromise the renal function as well. In diabetic patients, taking untoward medicines, over-the-counter medicines, it is not at all advisable because it gives rise to kidney injury. Other than that, diabetic patients have dyslipidemia, they have cholesterol imbalance, which can give rise to atherosclerosis, increasing atherosclerosis and narrowing of the renal vessels, which can give bilateral rise to renal artery stenosis and compromise the renal function as well. So monitoring your diabetic sugar level as well as checking your urine ACR is one of the primary preventive measures to delay ESRD in case of a diabetic kidney disease patient. Thank you.